The HIV virus causes AIDS and can be passed from person to person through bodily fluids such as blood and other body secretions. You can seek information from health providers on the various ways to prevent HIV infection. Testing for HIV is available at all public health facilities in Zambia for free. Testing and results are confidential and no one is allowed to disclose your status without your consent. If you are infected, antiretroviral therapy is available at all clinics and slows or stops the increase of the HIV virus, thereby prolonging your life. This message is brought to you by the Ministry of Health and the AIDS Healthcare Foundation.
Hi, and welcome to this special program brought to you by AIDS Healthcare Foundation, in short, AHF. This special program will be looking at AIDS. I know so much has been happening. We are now in the era of COVID-19. There's so much happening, and it's very easy to forget about some very pertinent issues that we've grappled with for years and then put tools down and defense down. And therefore today we are bringing back this very important issue of HIV-AIDS. We'll be looking at HIV testing, we'll be looking at prevention, treatment, we'll be also looking at care and support. And so to help me discuss this very important issue, I have special guests in the studio. And this is Misozi Soko from UTH. She's a counselor there. And of course, she's accompanied by Dr Chanda Chitalu. He's a medical doctor also at UTH. My name is Mundyongo. I'll preside over this particular program. Doc, you're welcome to the program.
No, thank you very much, and good to see you.
Misozi, you're welcome to the program.
Thank you very much. Good to see you.
Doc, HIV-AIDS, is it still an issue? I mean, we are talking COVID now. We've moved on, right? Why should we still go back and still discuss issues of HIV-AIDS? And before you answer, I know you still have a mask on. That just brings to the fore the fact that COVID-19 is still real, and we have to be very cautious about it, including my colleague Misozi here. For the sake of communication, of course, I had to take it off briefly, but it's something we have to continue taking care of. I know that normally when you have a mask on, sometimes communication is not very effective, but for the sake of prevention and emphasizing the importance of masking up and taking all the precautionary measures will allow you to have your masks on. Doc, please, you may continue.
All right. Thank you very much. So when we look at HIV and AIDS, we need to look at the subject matter. And because the whole world is moving to try and end the epidemic and to try and end it by 2030. So there are various interventions that have been put into play. But one of the things we need to look back is, since the epidemic started for HIV, how many people have been infected? Okay, over 30 million people have been infected. And we have had millions of mortalities occurring from the HIV epidemic.
I know when doctors are talking, they always speak their jargon. Millions of mortalities.
So basically, we're looking at, since the outbreak, started for HIV, we're looking at how many people have been infected, over 30 million. And we're looking at how many people have died from the disease, plus associated comorbid conditions, like other conditions. Again, these are high numbers. Therefore, there are strategies that are being put into place to say, can we end this? Because we don't want to lose people, and we don't want people to die. I mean, we are now with the National Strategic Plan where we say, leave no one behind. So based on that, we want to ensure that all HIV-positive patients and all those who are negative are not left out as we come up with strategies to kind of prevent as well as treat HIV. I know...
So just there, Doc, the thrust is, let's end it by 2030.
Yes.
And so whatever strategies, whatever efforts are being put into this is basically, let's end HIV-AIDS by 2030.
It's an ambitious target, if you think of it. Realistically, it's quite ambitious, but it's something that can be achievable. If you look at mathematics, you do calculations, you can estimate that if we put A, B, C, D into play, they can help us achieve the target. So it looks ambitious, and it's something that is still attainable.
Wonderful. Misozi, you are a counselor at the University Teaching Hospital, and you've been doing your work for quite some time. Is HIV/AIDS, the people you interact with, still an issue?
Yes, it is still an issue for many, especially that we still have people who believe the virus does not exist, especially with people like from the rural areas who do not have adequate information about it. And then in some cases where they have someone that is sick in the urban areas and they happen to be bedsiders, counsellors are moving around the world to conduct HIV testing. Talking to them about it is still an issue. So, yeah.
2020, there's still people in the rural areas who do not have information?
Not at all. They don't have.
How's that? I mean, what are you finding? I mean, you interact with these people.
I think there's little
What would you attribute that to?
I think there's little sensitization out there, especially in the deepest part of the rural areas. There's little sensitization about HIV.
Is it that people feel it's no longer an issue, or what could that be? Doc, would you have an answer to that? I mean, it's, this time, I mean, I think it's now since 1983, thereabout, when it was first announced or diagnosed, as it were, and this is 2020. And there's still people who don't seem to have information.
So yeah, it's very true. Not even going far much in the rural areas. Even just here in Lusaka, there still people don't know how to prevent HIV. There are still people who don't know that treatment is there for HIV. Just here in Lusaka. And there are still people who don't know that if they're exposed to the virus, there are ways of preventing themselves. And I think it stems from one of the things to say, if you become familiar with something, you won't learn new things. You know, like over familiarity, it becomes a problem because information will bypass you. So I think there's still a knowledge gap, and I agree with Misozi, not just far away, but even locally. Yeah.
Okay. Now, coming back to you, Misozi, just fill us in. What is it that you do as a counselor at UTH in relation to HIV/AIDS?
HIV testing services are being offered there, and of course counseling people out there in the community, sensitizing them about the importance of coming to these facilities to have their statuses checked. Yes.
Doc, I know you're a medical doctor, you do so many things, and here we're discussing HIV/AIDS. What do you do in relation to the subject matter today, at UTH specifically?
All right. So one of the things that I actually do is ensuring that, first of all, there's adherence to some of the policies that have been put by the government. But also I help provide training for those that give this service. And then also I attend to HIV positive patients. And so I look at what medication do they need to take, are they getting complications. I also look at HIV prevention in those that are negative, but might be related to somebody who is HIV positive. So it's a whole spectrum.
Now, let's move into our subject matter. One of the issues we are talking about here is testing, whatnot. Now, let's get back to the basics. Back to the basics. Since you're saying information is not really out there, what is HIV? It sounds funny, but yeah. Maybe let's get back to there. Doc, what is HIV? You may want to go back to the basics, I think.
Yeah, I'm glad you've brought it that, because if you start from the foundation, the basics, it helps you to build up. So as we talk about HIV, it's like an acronym, okay, an abbreviation. So H for human, and there's a reason it's saying human, because that's the host who gets infected. And then I is immunodeficiency. So there's an immunity, I think that's a Greek word, which means to protect you from something. That's what immunity means. And when you say immunodeficiency, meaning that there's absence of that which protects you from infections. And then the last one, which is V, it's a virus, okay? So we have a virus that infects a human being, And this virus now depletes your immunity. And this has implications. It's what will lead you to the syndrome which we call AIDS, because now your immunity is low, you become at risk of getting these secondary infections. And it's the secondary infections that predispose you to easily dying. But also, when your immunity is very low, it makes you not just not be able to defend against infections, but it makes you become at risk of getting other cancers. So HIV is just human immunodeficiency virus, and it causes a syndrome or a myriad of symptoms, which is called AIDS. And AIDS, basically, it's acquired immunodeficiency syndrome. So you see, the virus will cause you to go into this state where your immunity is depleted, and the depleted immunity now makes you become at risk of getting other opportunistic infections, which are usually either in the environment or they're within us, and they just now show up because there's no defense. Yeah.
Now, just talking still about there, Doc, we know, we've heard, we've read that there are types of HIV. Do you want to talk about that?
Yeah. So there are basically two types of HIV. And in Africa and well as Zambia, we have the two types. So there's HIV-1 and HIV-2. And I must mention that we do test for both. And we do provide treatment for both as well. And the issue is that with HIV-1, it's very common in our setup, okay? But also it easily gets transmitted from one person to another. And HIV-1 has got a high risk of your treatment failing. Whilst HIV-2, it's a slower kind of, not more infectious. It's there, but it's not as much. So it's quite low in terms of numbers. I must say it's less than like 4% of the whole population who are HIV positive, which is very, very low. And sometimes you find that some patients who have either HIV-1, they'll have either HIV-2, or they'll have both HIV-1 and 2. I think the good news is that despite having these two different types of HIV, the treatment is there for both. Yeah.
HIV-1 and 2. Then 2 is less lethal, would we say so?
So yes, it's not as bad as HIV-1. And it slowly damages your immunity compared to HIV-1. But HIV-1 gets transmitted easily, from one person to another. HIV-1 is very fast and easy to move.
Now, having talked about defined HIV as well as talking about the different types of HIV, of course you talked about testing. Let's talk about the importance then of testing, because I do believe that not so many people know their HIV statuses right now. There are very few of us that know our status.
So it's a very important question. So remember I said that we have these strategies to kind of end the epidemic by 2030. And HIV testing becomes the primary entry point to kind of get to that target. And so firstly, if we say we want a certain number of people to be tested, and we want over 95 now, that's what we're moving to. And the idea is that if people know their HIV status, 95% of people in the population who are likely to be HIV positive, they know their status, we can link them to the next step, which is being on treatment. And then from there we go to the third step where we want now those who are on treatment to kind of have their HIV viral load suppressed. And the idea now is that once they have their viral load suppressed, or the number of viruses in the body is suppressed, they reach a certain state where we say U is equal to U, or undetectable viral load becomes untransmittable viral load. Now, all this cascade starts from the primary point, which is HIV testing. Now, that's one whole public health approach. But on an individual level, if I know my HIV status, okay, so if I get infected with HIV today, for example, let's assume that way. If I'm not tested, it means that I have a risk of transmitting the virus to others. So if I know my status, I will put in other measures that will prevent me from infecting other people. Because once you are just infected with the virus, you've got so many particles of the virus in the body. Why? Yes, we have agreed that it depletes your immunity, but also because of the high viral load, it makes it easier for you to infect others at that time point. So public health approach, basically HIV testing becomes a key to make sure that all these other interventions are linked, but also on a single, as a patient level, HIV testing will help us now prevent infecting others. Now, the last point I want to highlight to us about HIV testing is that if I know my status today, I don't have to wait now. You know, if I know my status, I will prevent damage, because we said the virus depletes your immunity. So if I'm tested today and I start my treatment, my immunity is still quite high, and the virus will not have time to deplete the immunity. If you could remember well, a while back, what we used to do was that if I'm tested with HIV today, we would wait until the CD4 is like, you know, less than 350.
Yes, up to a certain level.
Yes, then we start treatment. Then we moved further. We said, if you are tested, we wait for CD4 to be 500. Now we're saying, test and treat. And that's
meaning the moment you test and you found HIV positive, you start treatment.
Exactly. And the idea is that once we test as many people as possible and we find them positive, we want them immediately, before the immunity is damaged, to start the treatment. And that preserves the immunity. Yeah. So there are multiple benefits, I think.
The benefits of testing. Now, of course, that cannot be overemphasized. Misozi, as a counselor, what do you think makes most of us not want to test, to go for testing? I mean, you have interacted with people. Are there some fears that people express? Just talk to us about some of these issues.
Most of these people are scared of the stigma out there, the discrimination, and some, they say, if I'm found positive today, I'm not this person that is able to start taking medication every day. Adherence to them is always a problem, and stuff like that. Some people, it is because maybe they have violent partners. How am I going to tell my partner? How is my partner going to handle this? And stuff like that. So there are a lot of reasons out there.
In this present day and age, you still have stigma?
Yes.
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 For HIV/AIDS?
Yes.
Okay. So fears are still there. But should these fears really be there? I mean, looking at the advantage of knowing one's status, what do you tell us then as a counselor?
These fears can be removed totally, but in every day of our lives, people are ever passing jokes about HIV, which just makes people so uncomfortable and stuff like that.
They pass jokes about HIV. Yeah, I thought that then doesn't mean that they've become familiar with it now and they can live with it? If they can joke about it and laugh about it?
It's still...
People just say, I'm nothing to topping up. I thought that should make it easy to live with now, and everybody else can
Some people would leave that place and still have thoughts in their head. Some will even think of suicide and stuff like that. It's still quite bad.
So now, I just want you to talk a little bit more, Misozi. I know you are... Let it out. I think right now there could be somebody who is watching this program.
Yes.
Okay? And they are going through exactly what you've talked about, the fears of stigma. I have a violent partner, for instance, spouse. What will I say? And I would rather live in ignorance, not knowing my status, than know my status. And, you know, there are all those things. Now, as a counselor, Misozi, what would you say to us?
I think it's very important for one to seek counseling at any facility or organization that offers HIV health services, because counselors do really help with the counseling sessions. Yeah.
As a counselor yourself, can you counsel somebody? Tell us, why should we go for testing?
Why should one go for testing? Because it is very important to know your status, to know where you stand. If you're negative, we'll advise you on the preventive measures. If you're positive, we'll talk to you about treatment, adherence, and stuff like that.
On that note, we'll just take a short break. We are looking at the issue of HIV/AIDS. I think it's a matter that seems to be overshadowed by COVID-19, and because of that, it seems to be just operating in the shadows, and it's quite very real. So we'll come back and continue to talk about the issue of HIV/AIDS. We'll look at the types of testing and many other benefits of testing.
The HIV virus causes AIDS and can be passed from person to person through bodily fluids such as blood and other body secretions. You can seek information from health providers on the various ways to prevent HIV infection. Testing for HIV is available at all public health facilities in Zambia for free. Testing and results are confidential and no one is allowed to disclose your status without your consent. If you are infected, antiretroviral therapy is available at all clinics and slows or stops the increase of the HIV virus, thereby prolonging your life. This message is brought to you by the Ministry of Health and the AIDS Healthcare Foundation.
Welcome back. We are still on this special program brought to you courtesy of AIDS Healthcare Foundation, AHF. We are discussing HIV and AIDS. We've looked at the whole definition again of HIV. We have talked about the issue of the importance of testing. We have looked at the various, the different types of HIV, type 1, and of course type 2. We've also looked at the benefits of testing. And I think we'll go just a little bit more on the benefits of testing. And of course in the studio I have Dr. Chanda Chitalu and Misozi Soko from the University Teaching Hospital. Welcome back.
Thank you very much.
Thank you.
We talk about HIV testing. I think let's look at some of those myths that go behind the curtains when somebody goes for HIV testing. What happens behind there? Because sometimes it'll be like, there's a tent pitched on ceremonies, some rural area under some tree, HIV testing. And you find some gadgets in there. Just fill us in. What really goes on behind there? We are sometimes afraid of needles, huh?
Okay, so when one comes for the HIV testing, definitely the first thing you let them know is why they are where they are. And we assure them of working out with results. If these results are negative, we'll tell them about the prevention measures. If these results are positive, we'll tell them about the importance of starting treatment there and then. Yes.
Doc, let's talk about HIV testing. Are there many ways, types, kinds? Talk to us about the various ways of knowing one's status.
All right. So HIV testing. So there are principles behind HIV testing. And basically the two main ones are that you can directly measure the virus and you can indirectly measure the body response to the virus. And
directly measure the virus, what do you mean?
Yes. So when we say directly measure the virus, we have abilities or lab support that helps us to detect in a given volume, in a human body or a human being, how many viral particles are there, how many viruses are there. So we can measure that. So
and you can actually know the number of viruses that are in one's body.
Yes. But you see, we don't have to take the whole human being and take him in the lab. No, we can take a small volume of the blood, and from that small volume, about 2 mL or so, and we can measure from that 2 mL to say there are maybe 1 million copies in that 2 mL, or there's 500 or 50,000 or 20. And the idea is that it helps us to see how you're responding to treatment. And I think most of us have heard of what is known as a viral load. And that's basically it, where we are measuring the number of viruses that are there in a given amount of blood. And we can
viral loads would simply mean, in layman's language, the amount of viruses per unit blood.
Exactly. So, and that helps us to see how you are responding to treatment. And we do it at intervals. So if you start treatment today, we repeat it after 6 months. Okay, we do it after 6 months. And we can do yearly, depending on how you're responding. But we always say that we want it to be less than a certain amount. And that helps us. Because if the viral load is low, we know that the amount of viral particles will be not enough to damage your immunity. And that preserves your immunity. So we're reducing the viruses, but we're also improving the immunity indirectly. So the viral load, I think most of us have heard about it, gets to be done, and we're measuring directly the virus. I must mention now a second type or a principle. We measure the body's response to the virus. Okay, and that's the one we mostly use for HIV testing. So the way the
body's response
to the virus.
To the virus.
Yes.
In other words, the way the body responds
to the virus.
There is a way that you're able to detect.
So I'll give you a simple example. When we are growing up, when you strike your feet and you've cut yourself, later in the day, you develop, or after some days, you develop a swelling in the groin here. In my language, we say umtantamfula. That is the body response to the damage that you had. But you see, it's taking a bit of time, a day or two, and you can feel it, and it's a little bit painful.
In my language, in Kaonde, we call it mumfumba. Normally happens in the groin.
Exactly. And that is the body's response to that injury that's there. So for anything, there is always a body response. And for HIV, we can measure that particular body response. And it starts to occur after a certain time period. And so for HIV, we'll start measuring now those small particles that the body is responding with to the HIV virus. And those usually are called the serological tests or the antibody tests. And they are the ones we use for HIV testing to detect if you have HIV-1 or HIV-2.
Doc, you are talking about the second type of testing, where you measure the body's response to HIV, type 1 and type 2. Just there, are you saying that the body responds differently, the different types of HIV?
No. So the response to both HIV-1 and 2 is the same. But when we are measuring, we can actually pick the particular response. So if you do an HIV test, you see that they'll show you a strip, which has strip 1, 2, and 3. Strip C, which is the control, and then there's 1 and 2. And as you put your blood there, we are measuring the response by the way the lines will come out. So we can able to say, okay, this is a normal response. There's response to HIV-1, there's response to HIV-2. And we can say you've got response to both HIV-1 and 2. Therefore, you've got HIV-1 and 2. But I must emphasize to say that when you test negative, I think most of the times they'll tell you to say, please do A, B, C, D to prevent you from getting HIV. And they recommend a repeat HIV test. And this is because of the window period. Because if you get exposed today...
When we say window period...
It's the time now. See, window period is like the same way we talked about umtantamfla, where it starts, you injure yourself, and then it will take a few days, then it shows off.
For it to manifest.
Exactly.
Okay.
So even the response to the HIV virus, it takes a bit of time for it to come up and show a positive result. And that's why we're saying during that time you can get a negative result, but eventually it can become positive. So
Doc, just there, I really need to understand this. So you were saying somebody can actually have the virus when it's still what you refer to as window period and still test negative.
Yes. So again, that's where now we say, if we suspect and you test negative, we can use now a different test to measure directly the virus. You see, because there's that lag time in terms of the body response. So if the body response is lagging behind, we can directly measure the virus. Now, in that period, the reason I'm emphasizing it, it becomes a risk time because your viral load might be so high, you can infect a lot of other people. Because you think, I'm HIV negative, so you become a little bit reckless. But your viral load might be so high and you infect a lot of other people. And that's why we want to ensure that when they are testing you, they'll ask you certain questions to screen if you've got HIV. They ask particular questions. They'll ask you, do you have like muscle aches? Do you have sore throat? Any fever? Those are symptoms of HIV. So you could have those symptoms, but your response is lagging behind. They'll still measure directly the virus. And when we look at this body response, most of the times they are done by someone who is trained. And this is because we want to give the correct result at the end of it.
The body response.
Yes, when we're measuring. Yeah, there are principles that we use. You know, we use confidentiality, okay, correct result, consistent result, counseling. Those are the C's that we use in terms of...
The 4 C's.
Yeah, for HIV testing. You remember these things. But the most important one is to give you a correct result. And that's why we want a counselor who is trained, an somebody who is trained in HIV testing. Now, when we say that, there are other interventions that we've come up in terms of HIV testing.
Before you come to interventions, as we're talking about HIV testing, The first type of testing, Doc, the direct measuring of viral load, as you're saying, you draw some blood.
Yes.
Okay? You said a little amount of
2
it.
mils.
Okay, 2 mils thereabout. And how do you get the blood for the second type of testing?
Okay.
Body's response. Is it the same? You have to draw blood?
Okay.
Talk to us about that.
So
Because
for
these are some of the issues we need to know before we walk in there.
So for the second type, we can actually just do a needle prick, or you can get a bit of blood.
Needle prick, what do you mean?
So you get a needle and just prick at the tip of the finger.
Ah,
And just get a drop, like the way we test for malaria.
okay.
So you get that blood and you put it on a small. We just need a little amount. But there are some times when you can get from here. So there are variations, but mostly we use a needle prick. Well, it feels a bit painful, but
It's a small sacrifice, isn't it?
exactly. It's like testing for malaria. Okay. I think that's how I would want you to look at it. Getting a small amount and you put on a testing strip. But for HIV screening, you can also do a self-test. And for that one, you don't need blood. So you just need to wipe the inside of the mouth and you put it on a strip and you'll be able to see the line. Now for that one, it's a screening tool, meaning that after that has come out, either positive or negative, there are instructions. And when they give you the strip for HIV or self-test or the oral quick, well, they will give you instructions on how to interpret it. The most important thing is that whatever result you come up with, you need to confirm it with the one that we do from the blood now, because it's more sensitive.
So, Doc, talk to us here. We need to know things. A strip self-testing kit that you're referring to, they just do a little...
Yeah, just to do a little swab in the mouth.
Swab in, you do it self-testing.
You can do it yourself.
Yes,
you can do it. So you see, you can do that at home. Okay, you can do that at a hotel. You can do that at work. But there are instructions on how to interpret.
So there's HIV in one's mouth?
No.
I'm just being... because, I mean, otherwise
So
I
again-
won't start eating with somebody else's food. Otherwise, I mean...
So again, it's just we are measuring the body response.
Okay.
You see,
So that's what I wanted to know. What are you measuring?
So it's a body response to the virus. That's what we are detecting. Okay. So direct measuring of the virus is usually done at the facility. But we're measuring the body response. You can do it at a pharmacy, HIV testing center, or at home. Yeah.
Doc, we are going to move on a little bit more. And I know we've talked about virological testing. I mean, you've just alluded to self-testing. Now, let's move on to when somebody has been found with HIV positive, as it were. The test has come out positive. What happens?
So the first thing that happens, I think no one is happy to get bad news.
Let me hold you there. Let me get to the counselor. Because these are the people who bring out this information.
Yes.
Misozi, yes. You've counseled somebody, and that person goes for testing, and the results are positive, and you have to break that bad news, as it were. Talk to us about it. How do you go about it? And normally, what is the response?
So there's pre- and post-test counseling. So before the client is tested, they're counseled about which result to expect, either a negative result or a positive result. And we also make them go through on how to interpret the results on their own, on the testing strips.
When you're dealing with
And
the
with-
self-testing?
Both self-testing and the determine and the confirmatory. So it's step by step. Yes, so we counsel the client on how to interpret the results. In case the results come out negative, in case the results come out positive, we prepare them on which result to expect.
So
Yes.
they are in the know, actually.
Yes, yes. So we prepare them psychologically, physically, and emotionally. So if the result is positive, we break the news to them. Some clients would be emotional, they would cry for 1 hour. You have to let them cry until they feel better. Yes. Further step, we link them now to the doctor.
Okay. You now, once you've done that, they've cried, they're now
They're
coming
okay,
around
they're
it,
ready to...
then you link them now to the doctor.
Yes.
So your doctor pick it up now, Dr. Chitalu.
See, now they've made my work very easy because they've done the counseling. And that's very important because you see, when we deal with HIV testing and they get the result, as much as I'll prescribe the medication, if the counseling is not being done well, what will happen is that they'll collect the medication from me, they'll go with them at home, and they'll just put it on a shelf. And that's where the counseling has to come in, because the counseling will be about the result, but also about adherence, meaning that they need to take their drugs every day. Now, when they come to me, I'll discuss with them the results and what has been discussed previously with the counsellor. And then I screen them now for other infections. And remember what we said is that because HIV depletes immunity, I need to screen for other infections that they might have that we could have missed. For example, they could be moving around with TB that we don't know. And we need to treat that TB first before we start the antiretroviral treatment. So I'll screen using the questions, okay? Because like I'll ask about are you coughing, fever, weight loss, all those symptoms. I'll go through all that. And if they show me any symptoms, I'll make sure I investigate for that particular suspected opportunistic infection and treat it. But if there is nothing...
Just there before we come to if there is nothing, why is it so important that that particular infection like tuberculosis must be treated before one commences antiretroviral drugs?
Yes. So when you have an opportunistic infection, what will happen is that when you start treating the opportunistic, if you miss it, for example, if you miss it, when your body, when you start treatment and you miss the opportunistic infection, what will happen is that your body's immunity goes up and it starts to detect the opportunistic infection. It starts to fight off the opportunistic infection. In the process, it will be damaging part of your body. Okay? And that's, in medical terms, we call that iris. So we don't want it to start damaging your body. That's why we need to treat that infection first. After we treat it, it calms down, then we can bring in the ARVs or the ART, so much that immunity goes up. As the immunity is going up, there are no infections around, there will be no damage occurring to the body.
Then that's a benefit, I think, for HIV testing, and especially when you are found positive, because then you also have an opportunity to have other opportunistic infections, as it were, treated as well,
yes,
or detected, isn't it?
Yes.
Now, very good. Let's move on very quickly since we are kind of running out of time. Now, let's talk about care. This person is now taking ART or is on ART. How do you care? How do you support? Let's talk a bit more about care and support. I think let's start with the counselor. Do you have any role in that?
With some of the clients, we do a follow-up. These follow-ups might be personal phone calls. You're able to communicate with this client to ask how they're doing and how they're feeling at that particular time. Who do they feel like they should talk to? If they haven't yet accepted the status themselves, they need to give themselves time before they are able to tell the other person who they feel they're close to about their status. So that's the whole channel and process that we take them through. And for us, the role of follow-up is just to ensure to say this person is taking their medicine even before that time for them to come back for review. So it gets easier as we communicate. Yes.
Now, just there in care and support, I know Doc mentioned a word adherence, as it were. And as a counselor, what do you tell them? Why is it important for them to adhere or to continue taking the drugs as advised?
Just as he said, this is in order to block other infections that may occur and stuff like that, yeah. Mm.
Okay. Doc, care and support. I know yours is to treat and to ensure. What role do you play then? because I think there will be subsequent visits. Just talk to us about that.
So our primary aim to get somebody into care is that very day they test positive. And if we start treatment immediately, so test and treat, if you start treatment immediately, you've got a better chance, based on evidence, of returning in care than if you start after 3-6 months. And it does, and we can extrapolate to say, if I start after 6 months, I'll probably get more other infections. By the time I come into care, I'm already very sick. But if you start me on treatment that very day, I've got a better chance. So we say test and treat that very day, start on ART. But also, it just doesn't end there. There is an aspect of psychological support, social support that comes into play. And as much as we see you at the facility at intervals, we want to link you up to a buddy, okay, or somebody that is with you at home and give you that support. When you come for your routine visits, as part of care, you get to be screened for infections that we've said, but also we look at how is your viral load doing, okay? How many viruses you have in the body. Also, we want to look at, are there complications you're getting from the drugs? I always say that when you look at a rose flower, you know there's that nice flowery part, but there are a bit of thorns around. And you might start taking the medication today and you feel a bit of headache. It could be the medication or not. It could be something else. And we want to look at those side effects with you so that we say, okay, this is not because of this, I think it's something else. And then we want to look at how the other body parts are functioning. For example, how is the kidney working? Because the kidney can be affected, either just because of HIV or other things. So we want to look at those aspects. And then also, we want to link you up because we'll be assessing your adherence, okay? And then we'll be looking at what is your social support at the background. So if we see you that there's poor adherence, we'll link you up to an adherence. Now, HIV is, when we come into the clinical care, we don't just focus on managing the HIV. Now, we will link you up to other services. For example, STI, okay? We want to link you up to STI clinics because it's one of the commonest ways of transmitting HIV. Secondly, we want to screen you for
STI, sexually transmitted
infections. Yes.
Okay.
We also want to link you up to other services. For example, for females, we want for them to have, cervical cancer screening done at regular intervals. So you get a whole package. And then we look at your setup as part of care. We will look at what are the preventive measures. Yes, you might be HIV positive, but what about those partners, because you don't want to transmit the virus to them? How do we provide care to your partners that so much that they remain negative? So it's a whole comprehensive package.
How do we provide protection to the other person? What counseling do you give them?
We sensitize.
Especially when one partner, of course, has been found to be positive. I'm just following up on the doc's statement that he made here.
Yes, so we sensitize them about the prevention measures. Yeah, there are some drugs to take, which will, as we go, we'll talk about.
Okay.
Yes.
We are there. Just talk about it.
Okay, so there's what we call post-exposure prophylaxis, which is PEP. This drug is given in a case where one has been exposed to the HIV virus. The exposure is sometimes occupational, sometimes non-occupational. So occupational, it might happen at a place of work, whereby maybe it was a needle prick, and you could know the status of the person who had that needle prick, maybe they are positive, or if you're not sure of where that needle prick is coming from. So where one is put on post-exposure prophylaxis, which is PEP. And sometimes the exposure might be through sexual intercourse, in case one comes in contact with someone who's HIV positive, or in case they don't know the status of that person and they feel they've been exposed to the HIV virus. So post-exposure prophylaxis acts like an emergency drug to block the accusation of the HIV virus in one's immune system. Yes.
PEP, post-exposure prophylaxis, meaning after somebody has been exposed to HIV.
Yes.
There's still something you can still do about it.
Yes, that happens within 72 hours of exposure.
Doc, talk a bit more about this. Is it possible, really? this facility where somebody has been exposed to HIV, but then they can still be assisted in terms of PEP, post-exposure prophylaxis?
Yes. So I can draw back attention to, prevention of mother-child to child transmission. Sometimes the child is already exposed in the womb already from an HIV-positive mother. The child is born, we still provide medication to prevent the transmission of the mother to child.
So that the mother does not
Transmit
transmit
to the child.
HIV to the unborn child.
Exactly. That's one of the principles, and it's been there for quite a long time now. But when we look at PEP, which is post-exposure prophylaxis, cardinal is the time interval. Because if you're presenting after a month of being exposed, probably the HIV virus has already established in the body. So I think time is of essence, and that's where most of us miss it. Because you present a week later when you had a needle prick at work, maybe, a week ago. So if you present early, we can give you antiretrovirals, which you take for a short period of time, just 28 days. Now, you must understand that we're giving you antiretrovirals. We're not going to use quinine to prevent you from getting the HIV virus. So there will be ARVs that you'll be taking, just like somebody who is got HIV positive, but it's just for a short period of time.
So already, as you're talking, doctor, I'm thinking of a child that would have been raped.
Exactly.
Or a lady or a man that would have been raped by somebody
Yes.
who could be HIV positive. And therefore, it's very key, isn't it, to ensure that, since you're talking about timing here,
Yes.
within 72 hours. 72 hours is how many days now?
3 days.
So within 3 days, that person must be presented to the health facility to access PEP.
Exactly. I think you've highlighted a very important point which looks at rape. For example, I think a lot of rape victims do get a comprehensive package. One of them is just to prevent sexually transmitted infections. Okay, so they might give an antibiotic. Other times they will not give an antibiotic. It will depend. Then they'll screen for syphilis. And if there's syphilis, they will treat for it. So it becomes a comprehensive package. Sometimes they'll say, okay, can we provide emergency contraceptives? Again, all these you can still get under one house or under one roof. And then part of that package for those who are rape victims is counseling. And then last but not least is that if they're HIV negative, and that's very key, if they're HIV negative, then they can access the PEP. And we go back to your question, I think, which talks about the importance of HIV testing. You can't get PEP if you don't know your status. I mean, what's the point of putting somebody on ARVs for a month who is HIV positive?
They're already positive.
Exactly. So you need to test them from the start and see, do they have HIV or not? And if they are negative, it becomes one eligibility criteria for them to get the post-exposure prophylaxis. Yeah.
Now, finally, I know we've already run time here, but I think in a nutshell or briefly, we need to talk about PrEP itself. I think pre-exposure, before exposure prophylaxis. What's the difference? Talk about that, Doc.
Okay. So I think I must mention that PrEP is part of combination prevention package.
Combination prevention package.
Meaning that we don't use it alone. We use it with other interventions. For example, condom use, PrEP, abstinence. You see that? We combine this. We want to encourage combination of these different preventive strategies. So when we talk about PrEP, we are talking about pre, which is before, and then pre-exposure. Exposure is the HIV virus. And we say, what is the exposure? Do I know my exposure? For example, your partner could be HIV positive and their viral load is high. That's an exposure factor. Or you are having condomless sex with multiple partners. And this is on the basis that the prevalence of HIV in Zambia is around 16%, which is quite high. We can just safely say, well, in 3 people, out of 5, 2 to 3 people are HIV positive. So if you have multiple partners and you're not using a condom, there's that exposure factor and you become a high-risk exposure. So we will say, well, so you take this pre-exposure before you're exposed. And we look at that because maybe your partner is HIV positive. So in a serodiscordant relationship, that's an example I can give you. So if your partner is HIV positive, maybe they have not started treatment, they have started treatment, or their viral load is high, then you are HIV negative. You can be eligible for PrEP. Now, when you take PrEP, if you are male or female, it takes different times to start working and prevent transmission of HIV. So for females, it will take about 21 days. For males, it will take about 7 days to be effective. Now, I must mention that it's not 100% effective, but at least it reduces HIV transmission by at least 92 to 95%. So that's why I'm saying now it is part of a combination preventive strategy. So you will be on PrEP. We want your positive partner to be on ART so that the viral load goes down and removes that exposure. Now, do you take the PrEP for a long time? You take it as long as there is exposure.
So there is no specific period of time or duration within which to take PrEP?
No. As long as there is exposure, you need to take. And you must be willing to take it. That's another cardinal thing. So if you are exposed, you need to continually take it. Now, when we look at PEP and PrEP and ART, the difference with PrEP is that it's just 2 drugs combined into a single pill. When we talk about PEP, it's 3 drugs combined usually into a single pill. And then ARVs most of the times are combined, and there are 3 usually in a single pill. So with PrEP, it's 2 usually combined into 1 single pill. And it's usually taken by somebody who is HIV negative, and we've said an example is serodiscordant relationships. Now, let's take a leaf from when you're driving. If you are driving, the car just doesn't stop like that. It takes a bit of time to slow. You know, braking, isn't it?
Yes,
exactly,
the process.
Exactly. The same for PrEP. If you start taking PrEP and you're exposed and your partner is HIV positive, and your partner becomes, the viral load becomes undetectable, we just don't stop it like that. Okay? So give it some time, usually a month, and from there, if your partner still remains negative, we can consider taking you off the PrEP like that from the last day of exposure. So it's not lifelong. No, you need to just take it when there's that exposure. So it's part of a combination prevention strategy. I think the other things that we look at in terms of combination prevention strategies are condom use, abstinence, okay, PEP, and voluntary male medical circumcision.
One of the measures, Doc, of HIV prevention, I think, or trying to reduce transmission, as it were, or passing on, in males especially, one of the recommended things is male circumcision. Talk to us about this very briefly.
So when you say male circumcision, what comes to my mind would be traditional male circumcision, which we have been doing for centuries. But when we talk about HIV prevention, we bring in a different dimension. We call it voluntary male medical circumcision. The first word is very cardinal, voluntary.
Voluntary
male medical
circumcision.
Yes. So we start with male. It's a procedure done on males just to remove the foreskin. Okay? And that has been shown that if you do that, you reduce HIV transmission by 60%. Okay? It's a good number, almost over half. And that's why, again, the circumcision will be now part of a combination preventive strategy. You combine it with PrEP, condom use, and you reduce transmission of HIV. Now, when we look at male, they have to give voluntary, consent. So every male can give voluntary consent. But in Zambia, there's an age for giving consent. Okay, so it should be at least above 18 years, if I remember very well. Now, if you're less than 18, can you still do it? Yes. Consent can be obtained through the parents or guardians. So every male can be able to get this male circumcision done. Now, there's a last word, which is medical. Okay, so this is different because it's being provided by somebody who has been trained to give it. So they receive a formal training. And the idea is that you reduce on adverse effects such as bleeding, infections, okay? But also it makes the procedure pleasant when you're doing it. Because what they will do is that because they are trained, they will inject some fluid medicine around the penis, and that makes it a little bit numb during the procedure.
So you don't feel so much pain.
You don't feel not so much pain. You don't feel pain when they're doing the whole procedure.
There is no pain.
You can be singing. Yeah. Okay. You only feel a bit of pain now after the procedure, but you would have been covered with, medication like paracetamol and given at regular intervals to kind of take away that pain. But we know that the bleeding risk is lower, infection risk is lower because it's being done by somebody who is trained to give the procedure. Yes.
Male medical circumcision, voluntary male medical circumcision. That is very key. All these interventions, testing, name it, adherence, and suppressing viral load and to undetectable levels, or because we want to ensure that HIV/AIDS is eliminated by the year 2030? Is it attainable?
I think it's ambitious, but attainable.
Ambitious but attainable indeed. We've been discussing the issue of HIV/AIDS, which is still with us, but has to be eliminated by 2030. An ambitious but attainable goal. So this time around, I was talking to Dr. Chanda Chitalu from the University Teaching Hospital, and of course, Misozi Soko, who is a counsellor at the University Teaching Hospital. This has been your host, Louis Mundyongo, on behalf of Loyola Television. Bye for now.
The HIV virus causes AIDS and can be passed from person to person through bodily fluids such as blood and other body secretions. You can seek information from health providers on the various ways to prevent HIV infection. Testing for HIV is available at all public health facilities in Zambia for free. Testing and results are confidential and no one is allowed to disclose your status without your consent. If you are infected, antiretroviral therapy is available at all clinics and slows or stops the increase of the HIV virus, thereby prolonging your life. This message is brought to you by the Ministry of Health and the AIDS Healthcare Foundation.